Good day, sir. So today, I'll be assessing the head and neck. So the first thing to do is you have to identify your patient, explain the procedure you are going to do with her, and answer her questions if she asks about the assessment or the examination you are going to do with her. So, good day, ma'am. I am Michelle Passion, your student nurse. So today, I'll be assessing your head and neck, and I am asking for your consent if it is okay to touch some of your body parts. Is it okay with you, ma'am? Okay. And after that, you have to perform hand hygiene to prevent contamination.
Ang pinauna.
Okay. And after that, you have to inspect the head and then the face, the color, the symmetry, and even you have to see if there are lesions or vascularities present in the scalp of the patient. You have also to see the distribution of facial hair if there are bald part, which may indicate to alopecia, and also you have to take note the facial expression and palpate the skull. So let's see. And if manifest infestations or lesions present in the scalp of the patient, don't forget to wear gloves for your hygiene. Let's see. Okay. Okay. After that, you have also to inspect the external eye structure of the patient, especially the eyelids, the eyelashes, the eyeballs, and the eyebrows. Also, you have to inspect also the cornea, the conjunctiva, and the sclera. And after that, you have to take note their color, and also if edema is present, also their symmetry and their alignment. So let's see. Okay, and after that, you have also to examine the pupils for equality of size, the shape, the reaction to light by darkening the room if possible, and also by using your pen light to shine the light on each pupil. So let's see. Okay. Okay, and after that, you have to test for pupillary accommodation and convergence. You have to ask the patient to focus on one object as I bring it closer to her nose. So let's see. Okay, so after that, you have also to test the patient's visual acuity using the Snellen chart, and ask the patient to read the smallest possible line of letters first with both eyes, and also the second one with one eye at a time. So let's see. Okay. Please read the smallest letter, ma'am.
L, E, F, O, D, P, C, T.
Okay. Please read also the smallest letter by covering your one eye.
L, E, F, O, D, F, T, O, huh?
Okay. And also the other side, ma'am.
L, E, F, O, D, E, C, T.
Okay. Okay, and after that, with the patient 2 feet away, ask the patient to focus on your finger, on my finger, and move the patient's eyes through the 6 cardinal positions of gaze. Let's see, ma'am. You have to follow my my finger. After that, also you have to inspect the external ear bilaterally for shape, sizes, and lesions if present in the ear of the patient. You have to palpate the ear and the mastoid process. So let's see. Okay, and after that, you have to perform an otoscopic examination. You have to pull the auricle down and back, and also you have to take note the cerumen or the wax, and also you have to take note if edema is present, and also the discharge or the foreign bodies and condition of the tympanic membrane. So let's see. Okay. Okay, and after that, also you have to use a whispered voice to test the hearing of the patient. Stand 1 to 2 feet away from the patient, out of her line of her vision, and also ask the patient to cover the ear not being tested and perform on each ear. So let's see. The other side, ma'am. And the other side, ma'am. Okay, and after that, you have also to inspect and palpate the external nose of the patient. So let's see, ma'am. Okay. So after that, also you have to palpate and lightly percuss over the frontal and maxillary sinuses. You have also to trans-illuminate the sinuses if the patient reports tenderness. So let's see. Remove your mask, ma'am. And also after that, also you have to occlude one nostril externally with a finger while the patient breathes through the other. And also you have to repeat for the other side. So ma'am, I'll cover your one nostril and you have to take a deep breath, and also I'll go to the other side, ma'am. Okay, ma'am. Okay. Okay, ma'am. Okay, so the next thing to do is you have to palpate the temporomandibular joint by placing your index finger over the front of each ear, and you have to ask the patient to open and close her mouth while doing that. Okay? Oh, ma'am, sige. Okay. And after that, you have to perform hand hygiene, and don't forget to remove your gloves if you have wear gloves. And also and after that, you have to inspect the lips, the oral mucosa, the openings by soft palates, the gingivae, and also the teeth and the salivary gland openings by asking the patient to open the mouth wide using the tongue blade and pen-like. Please open your mouth, ma'am. Okay. Also, the next thing to do is you have to palpate from the forehead to the posterior triangle of the neck for the posterior cervical lymph nodes using your finger pads in a slow and circular motion. See? Okay. Okay, and after that, you have to also inspect and palpate in the front and behind of the ears and under the chin, also, and in the anterior triangle for the anterior cervical lymph nodes. So let's see. And after that, you have also to inspect and palpate the left and the right carotid arteries. Also, you have to only palpate the only carotid one at a time and use the bell of the stethoscope to auscultate the arteries. Okay. Okay, and after that, you have to inspect and palpate the trachea and also the thyroid gland. See, ma'am? Okay. Okay, and after that, also you have to inspect and palpate the supraclavicular area. So let's see. Okay, and after that, inspect the ability of the patients to move his or her neck. So, ma'am, move your neck, ma'am, from right to left, ma'am. Okay, and okay, and after that, also you have to perform hand hygiene and document your findings. That's all, and thank you.